This comprehensive guide explores how seemingly ordinary water consumption habits can trigger frequent nighttime urination, medically known as nocturia. Particularly among older adults, this condition often disrupts sleep and reduces overall quality of life. Contrary to common assumptions, nocturia isn't always the direct result of aging, prostate enlargement, or bladder dysfunction. Instead, it can signal that subtle changes in daily routines might drastically reduce nighttime awakenings. Why are more older adults waking up to urinate at night? As people grow older, the body gradually decreases production of vasopressin, a hormone responsible for slowing kidney activity during sleep. This decline leads to kidneys remaining active throughout the night, continuing to produce urine and steadily filling the bladder. Compounding this issue, bladder capacity and sensitivity tend to change with age, responding to smaller volumes of urine with an urgent need to void. Consider Mr. John Smith, a 67-year-old from Willow Creek. For years, he restricted his daytime water intake, thinking it would minimize nighttime bathroom trips. Ironically, his body held onto fluids throughout the day and released them during sleep, disrupting his rest more severely. This pattern, unfortunately, is common among older adults who unintentionally mismanage hydration. Everyday habits that worsen nighttime urination. 1. Excessive fluid intake after 6 or 7 p.m. The body's natural rhythm prompts the kidneys to slow down in the evening. Consuming a lot of water or fluids late in the day forces them to remain overactive, leading to an overfilled bladder at night. 2. Consuming liquids like milk, juice, or soups at night. Even if you aren't drinking plain water, fluids in soup, milk, or juice still need to be processed. Herbal teas like green tea, artichoke tea, or lotus tea, often enjoyed for relaxation, act as diuretics and may worsen nocturia. 3. Just-in-case bathroom visits. While it may seem wise to urinate before bed regardless of need, doing so trains the bladder to signal urgency even when it's not full. This conditioning leads to more frequent and unnecessary nighttime awakenings. 4. Uneven water intake distribution. Many older individuals drink little or no water in the morning and compensate with heavier fluid consumption in the afternoon and evening. This imbalanced hydration schedule overburdens the kidneys right when they should be winding down. Ms. Sarah Johnson, a 70-year-old from Oakville, significantly improved her sleep after shifting her fluid intake to earlier in the day. Recommended water drinking guidelines for older adult. Urologists and health experts advocate for strategic hydration to minimize nocturia without sacrificing overall water intake. 1. Prioritize water intake between 6 a.m. and 4 p.m. This time frame, sometimes referred to as the golden window for hydration, aligns with the body's peak efficiency in processing water for essential functions. 2. Reduce fluid intake after 5 p.m. Starting in the early evening, reduce fluid intake gradually. After 7:30 p.m., limit water to no more than 5 fluid ounces, approximately 150 milliliters. 3. Take nighttime medications with minimal water when consuming pills at night. Only a sip or 2 is sufficient. A full glass isn't necessary and can increase the need to urinate. Mr. David Clark, a 68-year-old from Riverton, resolved his nocturia by adjusting both the timing of his medication and the amount of water he used. According to the American Urological Association, seniors should aim to consume 70% to 80% of their total daily water intake in the first half of the day. Additional tips to combat nighttime urination. 1. Practice relaxation before bed. Calming the nervous system can reduce nighttime wakefulness. Techniques include deep breathing exercises. Inhale slowly through the nose and exhale gently through the mouth, repeating 10 times. Gentle abdominal massages also help. To sleep in the right position. Sleeping on the left side with a thin pillow under the head and a soft cushion between the knees helps reduce pressure on the bladder. This position can also enhance circulation and promote deeper sleep. 3. Morning movement. Engaging in just 10 minutes of light exercise like walking, stretching, or simple knee bends in the morning activates the lymphatic system and encourages diuresis. During the day, Ms. Emily Davis, 74, from Lakeside, reported dramatic improvements in her sleep after adding morning exercises to her daily routine. For adjust your sleep environment, comfortable sleeping conditions support better rest. Choose lightweight, breathable cotton sleepwear. Ensure good airflow with an open window or a light fan, and avoid heavy blankets that may cause sweating and dehydration, which can later lead to increased thirst and fluid intake. Rethink your dinner choices. 1. Avoid high water content foods. While healthy, foods like soups, cucumbers, watermelon, grapefruit, and raw salads contain high water content that can increase bladder activity. At night, 2. Minimize salty foods. Salty foods encourage thirst, prompting excess water consumption after dinner. Pickled vegetables, salted meats, and soy sauce-heavy dishes should be limited. Ms. Brenda Lee, 75, from Sunshine Valley, found that switching her evening salad to lunchtime made a big difference. 3. Choose dry, simple dinners. Go for meals that are low in moisture and easy to digest, such as steamed potatoes, plain rice, and lightly cooked vegetables. These options reduce digestive strain and help prevent excessive nighttime fluid processing. Debunking myths about nighttime urination. Myth 1. Drinking less during the day prevents nocturia. This is not only untrue but counterproductive. Inadequate hydration thickens the blood, forcing the kidneys to work harder and causing fluid retention. The retained water often gets released at night. Myth 2. Only men suffer nocturia due to prostate issues. Thought prostate enlargement can contribute to nocturia in men. Women are equally affected. After menopause, hormonal shifts can thin the bladder lining, increasing sensitivity and urgency. Myth 3. Warm water at night detoxifies the liver and stomach. Though warm water aids digestion, consuming it at night still adds to your total fluid intake, which the kidneys must process. This leads to increased nighttime urination, potentially disturbing your sleep. Conclusion: in the quest for uninterrupted sleep, it's not just about how much water you drink, but when you drink it. Minor changes such as shifting your water consumption to the morning and afternoon, avoiding high fluid foods at night, and engaging in gentle exercise can make a world of difference. Nocturia may be common, but it doesn't have to be inevitable. By understanding your body's signals and creating new hydration and eating habits, you can reclaim restful, uninterrupted sleep and enjoy better health in your golden years. Taking these steps won't just reduce bathroom trips, they'll improve your entire quality of life. Thank you so much for watching. We truly appreciate your time and support. We hope this video brought you valuable insights and helped you make informed choices. If you found it helpful, please give it a like, share it with others, and don't forget to subscribe for more helpful content. Your support means everything to us. Take care and see you in the next video.